medical professionals that we need to come here to deliver the care that we provide. And that's a challenge for the Navy as well. It's not necessarily as easy as issuing a set of orders to any particular provider to get them to come to Guam and spend a 2 or 3 year tour on Guam. It's a challenge for us from time to time, but again, the capability or the capacity you have is not defined by the size of your building. Many people are surprised to hear that we are a 38-bed hospital when I talk about the Naval Hospital. Years past, people on the island that remember the Vietnam years and when we were in the middle of a Cold War where there were at times up to 1,000 or more patients at the Naval Hospital, it at that time had a designation of a Naval Regional Medical Center, which we no longer have. We're essentially a very, very small, a very limited community hospital with all the same challenges for provider expertise and nursing staff, perhaps not to as much a degree as Guam, but because we do have military staff that do come here on a regular basis, but it is a challenge, and I think working together, private, public, military, I mean, that's the only way I see that this can be solved for the island of Guam, because as I said earlier, healthcare is local, and Guam is a single community on a single island, and we all have to work together to solve these problems for the people of Guam.
Thank you, Captain. Dr. Booth.
Oh yeah, I guess I'll be brief. I think it's interesting that having come out here with the Navy, that although I was in the Army, I guess I must have been really bad. The Army just wanted to get rid of me or something. But when I came out here, and the first meeting I had was with the commanding officer at Naval Hospital, who said to me, the first thing I want you to do is go get your local license, because the Guam community needs you. At that time, the quality of radiology services were, like dialysis, lacking. There was rather primitive care in many areas, and radiology was one of them. And so I was strongly encouraged to get my license and to work out in the community. And a number of physicians have come through that same route, and I'm hopeful that during the build-up there'll be that back and forth working between the military and civilian community. In fact, it goes on every day in certain areas. And I'm actually working towards encouraging that now, towards the military knowing what is available out there and what can help the members of our community who are military. And remember, as the captain mentioned, so many of the people that they serve are not active duty. They are retirees, reservists, guardsmen and women, and so they, rather than being sent off island for care, can avail themselves of services that are available here. And far too often in the past, it's not true now as much, but in the past, the people who came on island serving in the military did not know what was available out there, and so would quickly jump to send people off island. And I think that this idea, first to answer your question, I might say we are trying to bridge the gap on both sides of the fence. We're trying to make better care further out from the centralized aspect of Guam Radiology Consultants, so that we have electronic abilities to communicate with, at this point, 7 facilities, as well as with Saipan and Palau, so that we can transfer information and images back and forth, diminishing the need to repeat studies and having a more, again, comprehensive approach towards imaging, which I hope will extend to the rest of the community. Plus, we're doing in-house training of staff as well, in anticipation of the need for additional services. But I think a point that cannot be emphasized is enough is the extraordinary impact it has on the individual and the community right now, that is of having to leave island for care. And I think it sometimes gets lost, and we start accepting this as normal. We don't have an oncologist on Guam right now because he needed to leave island for services that were not available on Guam. So the entire community has no cancer doctor right now because we don't have a specialist that he needed. That's why. And that his significant other needed. And so he had to leave to take care of 2 medical problems that, in my mind, I'm not going to, having been involved with the care, I'm not going to violate his privacy. He's been public. Those are the reasons that he left. Both of those specialists should be here, but they're not. And so the impact becomes dramatic, not just on individuals, but on the entire community.
Thank you, Dr. Bird. Now, I know we're short on time, but I wanted to see if there were any questions.
I have a comment.
Oh, sorry, Sarah. Go ahead. I don't want to cut you off.
As I'm equally moved by the story of the cancer patient in the 40-foot container. And as I listened to that, I thought about the millions of dollars that we spend today sending young people off island because we don't have the facilities here. And I don't know how many people know we're spending over $100,000 per person to send people off island. Many of them are already adults. They've been off island for 15 and 20 years, totally removed from their families, and the probability of them reuniting with them in their communities is unlikely because they've already grown up in Oregon and in Texas, and we haven't built capacity on Guam for 20 years. Yesterday I spent 4 hours with an 18-year-old who was a victim of sexual and physical abuse since she was 8 years old, wanting to return and longing for her family. As I stood in church the other night, a friend asked me, "Can you please help this woman who I was helping at Guam, San Jose? She's an elderly woman, Chamorro, who's living in the bus stop, who is homeless because she's number 24 on the GORA listing." We have severe and significant issues right here, right now. And the attention and the priority placed is incredibly minimal. It's just incredible. We have a major drug and alcohol problem on Guam, and $800,000 a year is the only amount that this government sees fit in putting towards residential treatment. $800,000 for tens of thousands of people who have drug and alcohol problems, which really inhibit them from meeting their full and fulfilling their full potential. So the point of the matter is these issues, social issues, and their health issues, and they will seep into all aspects of our life, are just so low on the totem pole. And as long as our community accepts this, again as a norm, accepts this as, well, that's business as usual, until we demand that they are placed in a higher priority, will continue to be that way.
Thank you, Sarah. And I didn't know if there was a question. I thought I saw someone. Can't see well, so I'm going to squint. At least I can see the orange.
Okay. I'd just like to make a personal comment about Dr. Burke's thing of integrating the record system. My wife and I were both in the hospital and the skilled nursing facility for about 10 weeks. I had to get hard copies of the records from the hospital to take to my clinic. I was astonished. And by the way, it's a national problem.
Thank you,
I
sir.
just want to respond to that comment, and thank you, sir, for sharing that, because I think that one of the critical infrastructures that is already in process is the whole the electronic health record system that would not only share information here on island, but also to other areas in the United States. But again, this is it's an important initiative, and again, one that addresses those issues. And additional to that is the whole issue that when we look at strategies for a sustainable future, it's already been discussed here, but you know, the issue of telemedicine is really the way to go. When we start looking at a national shortage of doctors, nurses, and many of those in the behavioral health and dental health professions, it's a national shortage. And I think that this is an issue that is even being addressed, that other incentives to